Thank you very much. It's more nerve-wracking to do 5 minutes than 2 hours, I can tell you. But anyway, I'm going to talk to you about what you've heard, the hospital readmissions. And you know that hospitals are being fined by Medicare to the tune of about $280 million in the fourth quarter of 2012. So they need solutions, and I believe assisted living has those solutions. If you look at the discharges, patient discharges, assisted living only gets about 1.5% of hospital discharges. And so I think assisted living can become a discharge site of choice if you just change your perception a little bit. If you look at all the things that drive readmissions, poor care transition, medication areas, lack of transportation, chronic disease, these are all things that assisted living is very good at dealing with. And then if you look at what drives hospital costs, healthcare costs, chronic diseases and functional limitations, when you combine those two things, costs skyrocket. Assisted living is very practiced at dealing with both of these issues, the things that drive readmissions and the thing that drive healthcare costs. You have built your industry on solving these issues, on working with these specific issues. But what you haven't done very well, I don't think, is articulated exactly what you can do and how you can do it. And so that's what I'm here to encourage you to do. But it's beyond statistics. It's about 99-year-old Harriet who needs to retain function in order to stay connected to the people that she loves, and that doesn't have access to programs, doesn't have access to getting to therapy even. It's about 82-year-old Eldo, who broke his back at age 82 and had to rely on his own resilience and his own strategies to recover fully because there was not a pathway laid out for him for full recovery. We need to start addressing these issues. Solve problems. When you can solve problems for people, solve those recovery problems for people, and you can solve healthcare problems as well, you have a winning combination. And I think that we can do that in assisted living. We can do that by leveraging what we're already doing. You want to compete with home discharge, which is the biggest competitor of assisted living. You solve healthcare problems. You solve consumer problems. Give them an opportunity and a pathway for the fullest recovery. Reboot a healthy lifestyle. If you look at all the things that assisted living already does, whole person wellness, socialization, that social connection, the interventions, the proven interventions that you can help people reverse the frailty process. All the things that Dan Buettner was talking about. Functional disability, if you look at a targeted intervention, functional disability affects over half of older adults. And there's a new thing, new identified thing called hospital-acquired activity of daily living deficits. People going into the hospital fully able to live independently come out with a brand new activity of daily living deficit, and then they're discharged home and there's no ADL support, there's no programs to intervene, there's no support of any kind to help them recover. So you all know people who are doing this right now. They have a crisis, they go downhill, they don't quite recover, they have another one, and pretty soon you're step by step on the path to frailty. And it's preventable. We can do something about this. And I think that if you look at what you have, it's not doing anything brand new, it's looking at what you have. Healthy lifestyle support. Investment in evidence-based interventions. You might already have equipment and programs that you've invested in that you're not leveraging. Wellness, we all know about wellness. You look at creating a 30-day recovery stay. What transition care plan and follow through, you already do that. Social support to trigger resilience, access to that evidence-based equipment and programs and help from staff, and a culture of well-being. You truly have the opportunity to lead here. Hospitalization is usually a trigger for behavior change, but it's pretty short-lived if you get back home and you're not immersed in that idea of recovery and well-being. My mom had a stroke about 10 years ago, and I can guarantee you that if we'd had an option for a recovery stay, we would have taken it, because from that point on, every time she was faced with the challenges, I can't, I've had a stroke. If we'd had an option for recovery, we would have invested in it. Healthcare reform is a great opportunity. Don't miss the boat by standing back and waiting for people to come to you and things to come to you. You've got to step forward and say, kind of shout and get on the stage and say what you can do. Going to close with a story. I was doing a pilot project for Keiser. We were at an assisted living. I gave a speech on regaining function. A woman came up to me on a walker, and she was crying, and she said, "I didn't think I was ever going to be able to go to my son's for Christmas again because I can't get up the stairs. Now I think I can." That is what it's all about. I invite you to check out the Keiser booth for their Growing Stronger solution, and I also invite you to speak with me if you'd like to have sort of a reframing. Thank you very much.